Hello everyone, I am Su Fan. Today, let's talk about mitral stenosis, or MS. Among the causes of MS, rheumatic fever is the dominant one. Because MS is a long-term process, it usually causes at least 2 years after the acute rheumatic fever. This is immediate inflammation of the valves. It will cause the formation of fibrous tissues and calcium deposit. We can see the leaflets are thickened, the commissures are fused, and also the caudal tendon become thickening and shortening, and finally causing the fish mouth shape valve. The normal mitral valve area is about 4 to 6 square centimeters. If this area decreases to at about 2 square centimeters, the left atrium pressure will be increased. But it is necessary to make a normal transmural flow. However, if this area continues to decrease to 1 square centimeter, the left atrium pressure should be as high as 25 millimercury. And then the pulmonary vein pressure and the pulmonary capillary wedge pressure should be elevated at the same time. And then the patient will present exertional dyspnea. And the long-term change will cause the pulmonary hypertension and also affect the right heart. If the left atrium becomes dilates, it will predispose the mural thromboli and atrial fibrillation. Due to the elevation of the left atrium, the clinical manifestations of the patients are usually dyspnea, hemoptysis, and cough. The dyspnea can be from exertional dyspnea to orthopnea and paroxysmal nocturnal dyspnea. There's another symptom, we call it hoarse. It is rare. It is because the oppressive left recurrent lingual nerve by enlarged left atrium and pulmonary artery. In the physical examinations, there is a typical finding. We call it a mitral fasciitis. From this figure, we see the malar flush with pinched and blue fasciitis of the patient. And some other signs we can find due to the mitral stenosis is the diastolic murmur. Please note that this murmur is a diastolic murmur. It is not correlated with the severity of the stenosis. We can hear it best when the patient lying on the left side in held expiration, and the most prominent area is around the apex. At the same time, we may hear a loud S1 sound, and also the opening snap, which can be heard when the leaflets are still soft and mobile. The signs due to pulmonary hypertension and enlarged right ventricle is also something we can find. during the physical examination. Graham's steel murmur can be heard when there is secondary pulmonary regurgitation. On the chest X-ray, we will see a pear-shaped heart. That means the left atrium becomes enlarged, and sometimes with pulmonary edema. There will be a prominence of pulmonary arteries, and sometimes if the right ventricle is affected, we can see the enlargement of right ventricle. On the ECG, some non-specific change, such as left-right atrium abnormalities, atrial fibrillation, and right ventricle hypertrophy can be found. This is the video of echocardiography. The typical change of the mitral valve is the thickened and often calcified with narrow fish mouth shape, and the left atrium becomes enlarged. The left ventricle is usually normal size. Sometimes we can also find the signs of right ventricle hypertrophy, tricuspid valve regurgitation, and pulmonary hypertension. Here is a diagram to show you how to separate the severity of the MS. We can use the mean gradient, pulmonary artery systolic pressure, and the valve area to separate different grades. If the valve area is lower than 1 square centimeter, it is a severe MS. Sometimes we will use a catheterization method. The left and right heart catheterization is useful when there is a discrepancy between the clinical and non-invasive findings. Here are some complications of MS. For example, the atrial fibrillation, acute pulmonary edema, thromboembolism, right heart failure, infective endocarditis, and pulmonary infection. About the treatment, for the patient who have MS, we need to make an echocardiography surveillance for different grades. And medication is a basic treatment. But because it is a mechanical problem, the medical therapy does not prevent the progression. Some medicals, such as beta blocker, diuretics, antiarrhythmic drugs, and some anticoagulants may be used in the patients with MS. Because this is a mechanical problem, surgeries are necessary sometimes. The surgical method includes mitral valvotomy and mitral valve replacement, and usually used when the MS is very severe with some symptoms. So that's all for this class. Thank you. See you next time.